चल Sammy, I think we are live, ठीक है?
So I'll put that flyer.
हाँ, एक minute. I will just make you host also.
Yeah, it disabled here.
ठीक है. चल Sammy, I'm making a move.
Yeah. All the
All
best.
the best. This
Thank
is live. एक काम करना, recording मत भूलना. They ask
Yeah,
for
yeah.
your...
Yeah, we
है?
do that. I just want to do this. Yeah.
चल ठीक है dear.
You
Take
can
care then.
see my screen. Just tell me.
I can see your screen. Yeah, I see
Yeah.
the flyer too.
Yeah, yeah.
दिख रहा है यार. Fully.
Yeah.
Bye.
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 Hi, Parul. We are already live, Parul. You have to unmute.
Hello, Samiksha. Yeah.
Hi, we are already live, Parul.
Okay.
So, and recording is also on. We have doctors waiting in the room, I guess. Can we take them board?
Brinda ji hai kya abhi?
Linda ji has made us host, and I will make you a host, and then she has left. She is on leave.
Okay.
Yeah, just a second. I'll give you the host. Yeah. Shall we admit the doctors are there, or Rekha Ma is busy?
हाँ हमें तो ठीक है हम yes बिल्कुल एडमिट कर लीजिए.
हाँ हाँ. Hi, good evening, Dr. Richa. Good evening, Dr. Gaba.
Hello, good evening, Samiksha. How are you? Hello, good evening, Parul ji. How are you?
जी नमस्ते मैं बिल्कुल बढ़िया हूँ शुक्रिया.
Richa ji, we are already live on YouTube. Yeah, and we have also started the recording, so we'll be able to provide you after the session. Yeah. Good evening, Dr. Gaba. So Rekha Ma is on a tour state-wise because we have an upcoming conference in September. So we have no idea where she's traveling today, but hopefully she joins us.
Acha, okay.
Good evening, Dr. Deepshika.
Your mic is off, ma'am. Dr. Deepshika, your mic.
Good evening, ma'am. Good evening, everyone.
Yeah, good evening, ma'am. Welcome.
ये करना कनेक्ट नहीं हो रहा.
पार्टी पे पिला दो फिर अभी आधे घंटे तक आराम 1 घंटे तक का सकते हैं. only आपके
पता नहीं
Good evening, Dr. Gaba.
कोई म्यूजिक चला के दिखा दो नहीं जरा भी नहीं
Yeah, but we can hear him.
ये ब्लूटूथ से है नहीं है नहीं आ रहा ना
Good evening, Dr. Kaba, sir. We are able to hear you, sir.
हाँ got it
Yeah, we can hear
Hello,
you,
I
sir.
I
Yeah.
I can hear
Yeah,
yeah
good evening, sir.
welcome
Welcome.
good evening how are you
Fine, thank you so much, sir.
नमस्कार
good to see you after long time yeah
Yes, sir. Yes, sir.
hello Dr. RP Singh welcome unmute yourself unmute कर लो
Hello,
hello
can you hear me?
hello doc hello
Yes,
good
sir,
evening
we
good
can hear
evening
you.
Hello.
Hello, good evening, sir. Yeah,
Good
we can
evening,
hear you, sir.
Welcome.
Uh-huh.
good evening Dr. RP
Good
Singh
evening. Good evening. How are you?
yeah good hello Deepshika good evening
Evening, sir.
yeah good evening welcome to the platform
Thank you, sir.
समीक्षा जी आप मुझे बता दीजिएगा जब हम प्रोग्राम स्टार्ट करने की स्थिति में
Yeah, we will wait for a few more parents to join. Just few minutes.
yeah sure
Yeah.
Yeah, we have still 1 minute to go.
Yeah.
I'll need to share my screen, ma'am.
Yeah, I will just give you a co-host rights. Just a second. I'm Deepshika, ma'am.
पंद्रह मिनट
भेज दिया लोकेशन एड्रेस
Richa ma'am, can we start? We should start, I guess, right? They'll keep joining. We'll keep admitting the participants in.
Yes, yes.
Yeah. Parul ma'am, would you like to start?
जी जी बिल्कुल कहते हैं उनका जो काम है अहले सियासत जाने, मेरा पैगाम मोहब्बत है जहां तक पहुंचे। ये शेर इंडियन एकेडमी ऑफ पीडियाट्रिक्स वेस्ट दिल्ली के लिए कितना सही लगता है। निस्वार्थ भाव से ये संस्था जिस तरह आमजन की सेवा व सहयोग कर रही है वह अनुकरणीय है। डाउन सिंड्रोम फेडरेशन ऑफ इंडिया और इंडियन एकेडमी ऑफ पीडियाट्रिक्स ने साथ मिलकर पिछले दिनों कई भव्य आयोजन किए, उनसे आप सभी परिचित हैं। मेडिकल कैंप से लेकर हमारे सेल्फ एडवोकेट्स के रिकॉग्निशन जैसे आयोजनों की स्मृति हमारे हृदय में अभी भी शेष। त्वचा संबंधी बीमारियों और परेशानियों जैसे महत्वपूर्ण विषय पर दोनों संस्थाओं के इस समायोजित कार्यक्रम में मैं पारुल आप सभी का स्वागत करती हूँ। और डीएसएफआई हृदय तल से आभारी है आप सभी डॉक्टर्स का, क्योंकि हम सभी जानते हैं कि डॉक्टर्स की लाइफ कितनी बिजी होती है और आप सब इस तरह के कार्यक्रम के लिए हमारे लिए समय निकालते हैं। आपका बहुत बहुत आभार। डाउन सिंड्रोम फेडरेशन ऑफ इंडिया और हमारी प्रेसिडेंट डॉक्टर सुरेखा रामाचंद्रन की तरफ से मैं आईएपी के प्रेसिडेंट डॉक्टर देवेंद्र गाबा जी का स्वागत करती हूँ। हमारे आज के बहुत खास मेहमान लेफ्टिनेंट कर्नल डॉक्टर आरपी सिंह जी एंड डॉक्टर दीपशिखा परिहार का मैं स्वागत करती हूँ। साथ ही सेक्रेटरी आईएपी वेस्ट डॉक्टर ऋचा परिहार का स्वागत हम करते हैं। हम सभी जानते हैं कि इन सभी कार्यक्रमों की सूत्रधार वही रहती हैं और अपनी एफर्ट से, अपने अथक प्रयासों से इन सबको कोऑर्डिनेट करती हैं। आपका बहुत बहुत स्वागत है मैम। और हमें जो डॉक्टर ज्वाइन कर चुके हैं, जो मेंबर्स आईएपी से ज्वाइन कर चुके हैं, करने वाले उन सभी डॉक्टर्स का और सभी मेंबर्स का हम स्वागत करते हैं। इस कार्यक्रम को आगे विधिवत रूप से चलाने के लिए मैं अपनी दोस्त समीक्षा सांचवान का आमंत्रित करती हूँ ताकि वो आए और हमारे मेहमानों को आपसे परिचय कराएं और कार्यक्रम को आगे बढ़ाएं। समीक्षा।
Yeah. Yes. Good evening, everyone, and welcome in today's session. Yes, I agree with Parul. It had rightly said that science is inherently neither a potential for good or evil. It is a potential to be harnessed by men to do his bidding. And today we are so proud to co-host this session with Indian Academy of Pediatrics, West Delhi, which is with all the dedicated doctor in their team are really harnessing the potential of medical sciences to empower, for good and utilizing it for the welfare of the, in the caregiving sector. And here we have the complete team of President IAP, Dr. Deepak Gaba, and Dr. Prashant Seth, Vice President IAP West Delhi, and Dr. Shavan Gupta, Finance Secretary, and a very hardworking individual and dedicated Secretary of West Delhi IAP, Dr. Richa Parashar. This is a dream come true kind of association, which we are and we will try to nurture till eternity. Now, let me put across a very brief intro of our experts today. This is again warms our heart to welcome a father-daughter Dr. duo as an expert to this session. First, I would like to share a little bit about Dr. R.P. Singh. He is a very renowned dermatologist of Delhi, having almost 4 decades of experience in his area of expertise, and has also dedicated half of his experience contributing to the service of the nation. Yes, he is an army veteran, and we can also call him Colonel R.P. Singh. We are fortunate to have you, sir, with us. And now coming to our main speaker, Dr. Deepshika Parihar. She has been practicing dermatology and cosmetology from a decade now, more than a decade now, and she is a very experienced and passionate and dynamic practitioner, and we are very, very happy to have her as a main speaker. Keeping it really short, you will get to know about her knowledge and experience when she gives her presentation. And now I would like to hand over to Dr. Devendra Gaba to address and to take the proceedings forward. Welcome, Dr. Gaba. Over to you.
Thank you, Samiksha ji. Thank you, Parul, and for inviting us on this platform. I especially thank Dr. R.P. Singh, who is not only a nice doctor, a dermatologist, and ex-army service person. He was my class fellow also. We did our graduation together. Yeah.
So
And I also welcome his daughter, my dear Deepshika.
yeah.
She's a renowned
you, sir.
dermatologist, and I definitely we all will learn a lot from her today. And she is going to help all the children invited on this platform. Now, I also thank Dr. Surekha Ma. I think she is not joined.
She's joined, I guess. Parul, I can see her.
Okay.
Rekha, you are there?
Okay.
वो यहाँ रहेंगे
Good
डॉक्टर गाबा,
afternoon.
लेकिन शायद स्क्रीन पर नहीं आ पाएंगी, ट्रेवल कर
Oh,
रहे हैं।
okay. Thank you. Welcome, ma'am. And I also thank Dr. Richa Prasher, our everlasting, very hardworking, energetic, and dedicated secretary, Dr. Richa Prasher.
Thank you, sir.
Dr. Richa. And I hand over to Dr. Richa for further proceedings. Dr. Richa.
Thank you, Dr. Gaba, sir. On the behalf of IIP West Delhi, I first and foremost want to welcome all the parents and children who have joined in today, logged in today to know more about from the experts, because without them, this program is not successful. And I'm honored to welcome Dr. Surekha Ramachandran. She's the president of Down Syndrome Federation of India and Down Syndrome Association of India. And she's an epitome of inspiration to many out there, to so many children and parents all over the world. I once again want to salute the hard work that she does and all of you do, including the parents and the secretary and president DSPS. Next, I extend my warm greetings to Mrs. Rashmi Joshi ji, who is the president of Down Syndrome Parent Society Delhi chapter and is an advocator of the Swikar and the Parivar self-advocacy group. She has been working very hard on it. And I want to welcome my friend, Mrs. Samiksha Sajwan, Secretary of Down Syndrome Parent Society. She has devoted her life for the cause of Down syndrome. And I've been in close association with her, and I find her as a very nice and a very genuine person. And I can't help but adding adjectives to each one of you. So sorry for taking a few minutes. I want to welcome Mrs. Deepti Mathur and Ms. Brinda ji for handling the technical side of it. And I want to welcome Parul ji. आपने इतना सुंदर हमारा वेलकम, हमारा अभिनंदन किया कि दिल को छू लिया. And she's a writer by profession, a botanist. She's a child activist, and she has also devoted her life, and she has lately worked a lot with even more than 200 experts. And I think during this journey, we are going to learn a lot. It's going to be a two-way process. And I want to welcome the faculty members once again, Dr. R.B. Singh sir, Dr. Deepshika Pariyar, for sparing their valuable time. So over to Samiksha ji and Parul ji.
Yeah. So without further ado, Parul, I think we should straight away go to a speaker. And we would-
बिल्कुल.
yeah. So we would like to invite Dr. Deepshika to address the parents. And parents, Dr. Colonel R.P. Singh will join us for the question answer round. So we have all the experts with us. Dr. Deepshika, over to you.
Good evening, everybody. I thank you all and for such a nice introduction. And I also thank IIP West Delhi especially for giving me an opportunity to be here for a very good reason. And I welcome all the dear parents who have spared time to listen to me. And I know it's not easy to deal with all this, but then I really appreciate that IIP West Delhi and the Down Syndrome Society is taking care of all these things. And so I'll just start. And today I'll just discuss about the basic skin manifestations which happen in Down syndrome, and what at home tips, what we can do, and where all we need a dermatological intervention. So we'll definitely have a question answer round at the end, so we can have the questions at the end. So I'll just start now. Coming to the very one of the most common manifestations of Down syndrome is dandruff. Now, dandruff is something which we see, which is there prevalent in normal population also, but it is something very common here which we see. So what we see is flaking. We are all aware how dandruff is seen. They are seen as white flakes in the scalp. But sometimes what happens is body reacts to that fungus which is there. It's basically Malassezia species. So we get an inflammatory response. So what we see is redness, we see scaling. So there we have, the patient becomes irritable. There is itching, there is fissuring. So how it is seen? So we see greasy scales. Now, it can be seen in children also. It can be seen in the adult population also. So when a child in the very initial phase, up to 5 years of life, initially the child, we can see a thick greasy crust on scalp. So that is cradle cap. So many at times, if it is severe, it is confused with other severe things, but we should be reassured that it is just simple cradle cap and it will disappear with time. We definitely need some topical antifungals and some even white soft paraffin to soften the crust, but something which we need not be worried about. Now, sometimes what happens is when the inflammation progresses or when the problem increases, apart from scalp, we can see red patches on our eyebrows, near the side of the nose, back of our ears, and scalp. So these are the areas which we see, and crusts also may be there. So how do we go about it? Now, patients normally complain of itching. It relapses and it remits. Theek ho jata hai, it happens again. So what we do, how do we manage? What are the general care tips apart from being just getting the treatment done? So what the first and foremost is regular. If I talk about it, is because it is happening because we have a fungus in our scalp, which is a Malassezia species. So that is aggravating the inflammatory response. So we need to eradicate that. So what we do is, first and foremost, is regular shampooing of our scalp. So that is very, very important. If we will not wash our scalp, say it has passed 2 days, we have not washed our scalp, it is still oily, it will again precipitate the acute episode. It will initially start from scalp, then it will involve the eyebrows, the sides of the nose, behind the ears. It is very itchy. And sometimes even on chest, back, and underarms, groins. So sometimes what happens is it is there on groins, underarms. People think it is the other fungal infection, the ringworm, which we say. But it's not that. It is everything is the manifestation of that simple dandruff, which now became seborrheic dermatitis. So I just mentioned, apart from, so regular shampooing of the hair is very important. Another important thing is, do not do oiling, because contrary to the myth, people believe that scalp dry ho raha hai, we should apply oil. But we should not be applying oil, because that would aggravate those fungal elements and will aggravate the problem. So this is again a picture showing, see, we can see how thick crust, greasy scales are there in the scalp. This is a child showing that cradle cap, which I just talked about. So we have lot of topical over-the-counter anti-dandruff shampoos which we can use. How do we use that shampoo? That is the very important aspect, because we all use shampoo, anti-dandruff shampoo, but it doesn't work. So there has to be a way. So we do whatever normal shampoo we are doing, we'll shampoo our hair with that first, so that all the greasy scales and everything is removed. Then we'll take that anti-dandruff shampoo, few of it, massage it well, put it in the scalp. It is very important here. We are treating our scalp, not hairs. So it has to be applied in scalp, because it has a medication in it. So it has to be left on for at least 5 minutes to act. Then it needs to be washed off. Initially, whenever there is there is a lot of dandruff, so we can use it as early as on alternate days. Then we can reduce the time to twice weekly. Twice weekly, we need to maintain it for a long time so that it doesn't recur again. Moment after thrice weekly, you'll just stop it, it will happen again. So that is very, very important. That is maintenance therapy. Otherwise, you'll again need to rush to the dermatologist. Sometimes just the antifungal, the shampoos, anti-dandruff shampoos will not help us. Over-the-counter dandruff shampoos will not help us. there we'll need the help of a dermatologist. So you can get in contact with your dermatologist because they will provide you with anti-inflammatory drugs, because redness is there so much that it will not be relieved without medication. Sometimes it is severe. Don't be scared that why am I being given oral medications, because they are important to get it treated. Otherwise, it impairs the quality life. Now, our other next common condition which we normally see here is eczema or atopic dermatitis. Now, atopic dermatitis is again a very chronic relapsing condition. It becomes fine, it happens again. And normally in most of the patients, we have a family history also. And plus there, it can be associated with respiratory symptoms like allergic rhinitis, bronchial asthma as well. So what is important here? What do we see first? We see red itchy skin with scaling. We can see itchy brown bumps. And in long run, because of continuous itching, the skin gets thickened. So what we label at this as chronic eczema. Now, where all it happens? So if in a small children, say 2 months to 2 years of life, it will predominantly happen on face, which we called as malar erythema. So what we'll see is redness on cheeks, and we'll be confused what it is. So the child will keep on having redness of cheeks. It is basically a part of atopic diathesis. Then as the child grows, 2 months to 12 years, say, it will involve the extensor. That is the external aspect of your arms, forearms, and these are the areas. Then as we grow older, that is adulthood, it will happen in the folds of the body, like neck, the forearm here, the fold in the forearm, the fold at the back of the legs. Why? Because the allergens tend to get concentrated there. On the other areas, allergens tend to get washed away. But the good part is that most of the children, they will improve after 12 to 15 years of age. And even if they don't, around 60% of the patients have mild symptoms that it can be managed with certain home care is very, very important here. I'll just tell that what all home care we can do. And very few of the patient will need oral immune suppressive agents, because it is an autoimmune, immune system has a problem here. So very few of our patients will need all that. So so this is just, I was talking about a small baby will just show a redness on the cheeks. And as we progress, we can see that it can involve the body parts also. We can see it happening behind the knees, because these are the folds below the neckline, and sometimes the entire body. So when does it flare up? Suppose a patient has atopic eczema, but suddenly it increases. Why it increases? Any changes in temperature, sudden increase or decrease in temperature, excessive sweating, decrease in humidity of the temperature, suddenly the weather has become very dry, or contact with irritants like wool, chemicals, cosmetics, cigarette smokes, and very importantly, aeroallergens like house dust mites, pollen molds, pet dander, human dander. All these will flare atopic diathesis. Now, why is identifying the thing and treating it at the right time important? Because in the children, if we identify it at the right time and we manage it properly, it will not progress and might not even involve the other systems. Like, as I said, that sometimes allergic rhinitis and asthma can be a part of entire atopic spectrum. So that can be controlled. So this is known as marching of the disease. Initially, we only have skin symptoms. If we control it right then and there, marching can be avoided. We can avoid early treatment, can avoid the extension to the respiratory symptom. So that is why primary prevention, secondary prevention, and tertiary, everything is important. Now, what is primary prevention? What we can do at home? I already told that we need to avoid the triggers. We need to avoid certain allergens, common allergens in our surrounding. Now, what are the common allergens? We all keep carpets and curtains in our houses. So everybody whosoever has a child with atopic manifestations, try and not to keep carpets near the child. And if there regular vacuum cleaning of the carpets and even curtains is important. Regular changing of the bed sheets is important. See, these are very minor things, but they can actually prevent the acute episodes. So that is very, very important. Secondly, certain food allergies are also associated with that, and we need to avoid certain foods like sometimes eggs, fish, wheat, soy, peanuts, and even at times milk. So because these will at times when we get these patients tested, when we get a say food allergy testing done, then we can find a positive association. So it is at home, we need to be sure that we are avoiding all these things in the initial stages. Sometimes what happens is that another most important aspect of the treatment is moisturization. Here the skin doesn't have a barrier. It cannot fight with the allergens. So always it is important that we keep the child's skin moisturized. So when do we moisturize? How much do we moisturize? Again is important. As soon as you've given your child a bath, moisturize it immediately within 2 minutes of giving the bath, because that time the skin is very wet. It is wet, so it will absorb all the moisturizer. Avoid fragrance containing moisturizers. We do have lot of perfume based moisturizers available in the market. Avoid all of them. Use a simple without perfume moisturizer. You can see the content: ceramide containing, shea butter. All these are good things for skin, so apply that. Even coconut oil is one thing which works well. Mustard oil, olive oil is to be avoided because they are potential allergens. Coconut oil is one thing which we can apply. So once we have given the bath to the child, and we need to moisturize the child well. Another important thing is whenever the child is going out for play or to some outside, there are always potential pollens and everything is there. So that can be, if the skin is properly moisturized, these pollens will not settle onto the skin. So it will not flare the acute episode. So this is another important aspect. Now, suppose a doctor has prescribed us a cream and we also have to apply the moisturizer. So another important thing which we as a parent, we all should know that first apply the medication to the affected area, then apply your moisturizer. Otherwise, the medication might not work well. If you apply a layer of moisturizer, the medication will not penetrate and will not be able to clean those red patches or red bumps which we have on our skin, right? So this is something which is very, very important. Nowadays, we do have a lot of preservative containing food items, chips and everything and whatnot. So avoid all that, because these preservatives are also potential allergens, act as potential allergens and can aggravate our atopic dermatitis. So this was the general home care. Yes, if the disease doesn't stop and if it is aggravating, again, we need to go to a dermatologist for proper management. But then it will be treated for some time. Parents always say, ye to theek ho jata hai, but it happens again. Only thing is, if we are managing it at home with proper moisturization and proper care, we are avoiding all the allergens, the episodes will not be frequent. And as the child grows, the disease will also settle down. So I just mentioned about do's and don'ts. Limit your shower time 5 to 10 minutes with a hypoallergenic soap. No perfume-based soaps and no detergent-based soaps. We have a lot of Cindered bars that can be used. To apply emollients regularly and immediately after a bath. Wear a loose cotton clothing. Even woolens can be aggravating. We always see that as winter season comes and children who are wearing normally woolen directly onto their skin, it will aggravate. It will aggravate the dermatitis. So always wear a cotton clothing first. We can use beneath as a first layer, we can wear a full sleeves cotton clothing. Thereafter, we can put on our wearing. And also we need to know our precipitating factors: seasonal changes, emotional stress, dust, and these can be different for a different child. It can be sometimes all of them can act as precipitating factors, and sometimes few might be there in some and few might not be some. Do not take a shower with hot water because that will impair our barrier and will make our skin more dry. Do not use moisturizers with perfumes and chemicals. Do not wear tight fitted polyester clothing. And as I already mentioned, we need to avoid food triggers also. So sometimes it is not just atopic eczema, it's just simple xerosis, which we see in our children. The skin is very dry, rough, inelastic, and with time, because that dry skin is also itchy, so there is generalized dryness. It is the entire legs, entire arms, which we see. It becomes more common in winter. So again, the moisture rule, that moisturization rule is very, very important. It controls xerosis to a large extent. So this is how the skin appears, because itching is there. So once the child or a patient will itch, it will get infected. So eczema can develop there. So it is not atopic, might not be atopic, but it is generalized dryness, which we need to manage. Now there is another condition which is known as hidradenitis. I know the term is very, very, appears to be dangerous, but it is a condition wherein we see a lot of bumps in the folds. Like we can see red painful bumps in the underarms of the person, or even in the groins. So what happens is, because it is a disorder of the hair follicle along with the sweat gland. So all these body folds are hairy and they have sweat gland also. So they get occluded and get infected. So it is a painful condition. Immediately medical treatment is advised. So you need to be well aware and identify, and because it will pain, but it will not point. It will not point as a boil. You'll just see a painful lump. So you might get confused what it is, but it is something where medical management needs to be sought. And so that it doesn't happen again and again, cleansing, personal hygiene is very, very important. Whenever we see such lesion, cleansing with simple betadine lotion, which is available in the market, it is very, very important. Hair needs to be trimmed or clipped regularly. Shaving and waxing creams are to be avoided. So these are the general care. So this is how it looks like. And if it is not treated, it can become like a bigger boil and, a surgical intervention, or even it ruptures and it forms a big erosion kind of a thing. So it is important that we identify. Again, it is recurrent. It can happen. It can settle. It can happen. So general measures are important. Another important thing is that weight. If somebody is obese, this will happen more frequently. So weight reduction is very, very important here. Now, another harmless condition is keratosis pilaris. Again, a difficult name, but it is very important to identify this condition. Why? Because a lot of parents get worried what it is not going, but it is something which we should be aware and not to be worried about much, because it is just a problem which will not cause any problem. So what it is that it is basically it is a tiny bumps we can see. And why? Because the hair is not able to come out. Hair gets trapped in there. So we see a tiny bump. It is commonly seen on the upper and outer arms, thighs, cheeks, trunks, buttocks, but most commonly on the outer arms. And usually at puberty, at the onset of puberty, we see such things. So this is a condition. At times we can get confused. It can be confused with pimples or acne. But it is not acne, it is not pimples, it is keratosis pilaris, but that is occlusion of the hair follicle. So nothing needs to be done much. We can give moisturization is important here, because if we don't moisturize, it will itch. Moisturization is important, and sometimes if you'll go to the doctor, they will prescribe you keratolytics, that is skin shedding agents. So dead skin is shed and they reduce. But nothing eventually works on them. So, but just to be reassured that it is not something which you should be worried about. Now, another condition is palmoplantar keratoderma. It is basically thickening of the skin of our palms and soles. So the skin is very, very thick. Sometimes fissuring can happen. It can be associated with atopic eczemas. So here we need to sort a medical treatment so as to not to impair the quality of life. Now, another problem which we can see commonly is alopecia areata. This is very, very common. So what happens is suddenly a round patch develops in the scalp and there are no hairs in it. And usually while hair cutting, the barber notices it or the mother notices it while combing the hair. So just to tell you, tell you all that in most of the patients, it is self-limiting. The hair would come back by itself. But just for your apprehension's sake, we prefer giving treatment so that the hair comes faster. So, and also one more thing, that it can relapse and wane, whether it can relapse, it can settle down, it can relapse. So nothing to be worried about as such. It can happen. It is a normal phenomena with the thing. Only thing is sometimes it is extensive. So we need to look out for other associated conditions. So this is a simple patch, alopecia areata patch, which can be seen. So if it is very small, nothing is to be done. The hair would go back again. Now it can come back in 3 months, 6 months, or even up to a year. So, but it will come. So, but if the patches are increasing and you're really worried about, then you can seek a medical intervention. So now coming to fungal infections. So very, very common in India. It's an epidemic kind of situation like everybody is facing, common in children, our children as well. So what do we see? We see ring-like infections on our body parts, and they are extremely itchy. There can be sometimes bumps also. So it is important to identify it as that this is a fungal infection, so that we do not apply over-the-counter creams available given to us by our chemist. So they usually contain topical steroids, and what happens is that it modifies the problem. So once the problem gets modified, so it becomes difficult for the doctor also to diagnose it, and becomes difficult to treat it as well. So this is how it looks like. It can happen anywhere on the body. This is an example of fungal infection of the toes. If the feet is very sweaty, then fungal infection. So it will look like a dry, scaly patch on the feet, and sometimes in between the fingers also there can be involvement. It is itchy. So similarly, fungal infection can happen in nails also. Now, what is the what are things which we are supposed to do as parents to minimize fungal infections or to help aid in treatment is, first and foremost, is to keep the area dry. That is very, very important because it grows in the moist environment. So keeping the area dry is very, very important. Secondly is washing the clothes of the infected person in hot water, so that the fungal spores are killed. Because if we'll not wash our clothes, we'll just apply antifungal creams, you'll keep on getting reinfected. So that is another thing. If we cannot dry our clothes in sunlight, we need to iron them as well. So this is important. Also, whenever a doctor has given us an antifungal medication, it has to be applied regularly, and do not miss the dose, and apply it beyond the diseased area. Suppose there is a ring, so we need to apply it beyond the ring, so that it doesn't spread. And always complete the course of the medications prescribed by your doctor, so that it doesn't relapse or flare again, or doesn't involve the other areas, because it is extremely itchy and it makes the difficult. Now, identifying common bacterial infections. So which we normally commonly see is this impetigo. This is a normal bacterial infection. We have a bacteria known as Staphylococcus, which infects. It is commonly seen in face of the children, on the face of the children, and it will present as a red patch with lot of crusting, yellow colored crusting, and it is painful. Again, why we need to identify? So we do not apply any other cream given to us by a chemist. So only antibacterials need to be applied here. Proper cleansing is important. Sometimes if it is extensive, the child can get fever also. So nothing to be worried about. It is because of this. Seek medical attention, it would be fine. So this is a tiny follicle infection, hair follicle infection. So this is known as folliculitis. Sometimes it can increase and form a furuncle also. So these are the common bacterial infections which we can see. We just discussed about bacterial and fungal infections. Now we'll just see about something called parasitic. So there is a parasite or a mite which infects our body, which is known as scabies mite. So what happens? It is very common in children. It infects the body. We cannot see the mite. It is very, very tiny, and it will infect our folds, web spaces, and the mite comes out at night to take the feed. So the itching happens predominantly at night. So if you see some red color bumps on abdomen, medial aspect, inner aspect of thighs, chest, on the inner aspect of the forearm or the web spaces, and in small children it can also be seen on palms and soles. So, and the small child is irritated because of itching, and the older child is itching the entire day, especially at night. So we need to suspect scabies, and we need to take appropriate treatment. Apart from treating the child, all the family members also need to be treated. We need to wash the bed sheets, the quilts, whatever the child has used after medicine application, and a reapplication, treatment after 7 days is important, because these mites lay tiny eggs, so they need also be treated. So this is how we can see it. This is a picture of small child, showing tiny bumps everywhere. The child can be irritable, because of itching. Very small children, if they get infected from their mother, they'll not show signs of itching, because that time our itch system is not, the nerves are not very well developed to carry those itch impulses. So that child might look normal to us. Now, another important is acanthosis nigricans. Again, a difficult term, but a very, very common condition. We see, this is how it appears: dirty looking neck. It is black. We'll see a lot of people with black discoloration of neck, underarms, groins. We always wonder what it is. Sometimes parents think it is just dirt. The child is not taking bath regularly. We need to clean it. But it is not that. It is thickening of the skin. That is why it is appearing dark. Why the skin has thickened? Because there is a hormone in our body known as insulin, which metabolizes all the glucose which we eat. So sometimes what happens is that insulin is not able to work well. So this is known as insulin resistance. So this is important because usually obese children have this. So we need to get the test done. We need to seek medical attention. Apart from that, first and foremost is weight reduction, lifestyle modification, because then this is a problem. This can be a problem in the future. So we need to include a lot of physical activities in child's life. We need to cut down carbs. We need to cut down junk food and ensure a healthy intake of diet. Now, there are certain other conditions which can be common and which can be seen as psoriasis. How do we identify psoriasis? We see red or scaly plaques. The scales are very, very thick. Again, where do we see? On elbows, on knees, on lower back. But sometimes a single patch can be seen. Again, nothing to be worried. We can seek medical attention. Psoriasis can be controlled. It is as good as cure. Nothing to be worried that once we see a patch and we get panic, oh, it is psoriasis, it will never be treated. Nothing like that. Mostly we see such localized patches. They can be controlled with medical treatment. Rarely if it comes back, it can come back because it is there inherited. It is a genetic problem. It can come back. But whenever it comes back, we can seek the treatment. It would be fine again. So it is important. I have included this so that we can identify and we can treat it as soon as possible rather than allowing it to spread or be a more thicker patch. So now coming to leukoderma or vitiligo, that is also something which we can see. It has a higher prevalence. So we can see as white depigmented patches. Again, it is just a cosmetic problem. In India, though it's a taboo, but believe me, it is not a disease. It is just a cosmetic problem. It is difficult if somebody has a vitiligo, it is difficult to, as a social acceptance is low. So, but for the initial patches, initially we can seek treatment. The prognosis is good in children for the body forms. So early treatment is advisable. Now, syringomas. This is something which is very, very common we see in the children of up and downs. So, we should not be panicked because it is just a simple benign growths of the sweat glands. So this is how it looks like: tiny, discrete, white-colored bumps around the eyelids. So nothing to be worried about. They will not cause any damage to any system or anything like that. If as the child grows, we can just treat it with RF cauterization if you want. If they are very less, we can ignore it as well. Now, calcinosis. So this is how it looks like. Very white colored tiny bumps. They are hard. It is important because this is a condition which we normally do not see in general population, but we see here. So it can be confused with other infections. So, but it is again self-limiting. It would be fine by itself in some time. They are very hard. Now, oral lesions. Oral lesions is something which is very, very important. Why? Because this is very commonly which we see is geographic tongue. Now, what we see in child's mouth is that we see red color patches on the tongue. Sometimes they are there, sometimes they are not there. And parents might get apprehensive that what it is, why has the tongue suddenly become red? What did the child need? But it is just a self-limiting condition. Nobody knows why it happens, but it happens in some people or some associations it has. It is asymptomatic, doesn't harm the child, but at times very rarely can be painful. So in that case only we need treatment. Otherwise we do not need any treatment apart from keeping a good oral hygiene. That is all. So again, we need to not to be worried about this condition. Now, angular cheilitis. This is again which we common. Sometimes what happens when we sleep or when we are talking also, the saliva dribbles out of the mouth. So in the folds of the angle of the mouth, this saliva tends to get accumulated. Once it is accumulated, it will lead to irritation. Sometimes the child is using paste, gel-based paste. So irritant reaction can happen here and it can look like this. Excuse me. So identifying the cause, we know as parents, we know whether the saliva drools out or not, what kind of toothpaste the child is using, or sometimes secondary bacterial or fungal infection can also happen. So here we can consult our doctor and get it treated. Sometimes what happens is with people who have dry skin or atopic eczema, the child has dry lips. So the child keeps on licking it like this. So this is what happens is the child licks so as to make it wet and the child feels comfortable. But the problem is the saliva has the ability to digest this, our skin tissue. So the saliva will act here, make it all the more dry and it will become black in some time. So this is known as lip licking dermatitis. So we need to identify this and counsel the child and prevent this habit. We have to break this habit. So that was all for the thing, skin and the common oral lesions which we see. I hope it helped you.
बहुत बहुत धन्यवाद डॉक्टर दीपशिखा। जिस तरीके से नॉन स्टॉप बोलते हुए आपने हर एक एरिया को कवर किया है और इनमें से बहुत सारी चीजें हैं जिनसे हम आइडेंटिफाई कर पाए हैं कि ये प्रॉब्लम्स हमने अपने बच्चों में कहीं ना कहीं देखी हैं। और आपने जिस तरीके से बताया है ये हम बहुत डराती भी थी और लगता था कि कैसे होगा, लेकिन इनमें से ज्यादातर के लिए आपने कहा है कि ऐसे ठीक हो जाती है जल्दी। तो शुक्रिया। हमारे दोस्त जो भी सवाल पूछना चाहते हैं वो अब सवाल अपने पूछ सकते हैं। आप हिंदी या इंग्लिश किसी में भी अपना सवाल पूछ सकते हैं, या तो आप हैंड रेज कर सकते हैं या फिर आप चैट बॉक्स में अपना सवाल भेज सकते हैं। हिंदी या इंग्लिश में किसी में भी आप पूछ सकते हैं। ट्रांसलेशन के लिए मैं और समीक्षा यहाँ पर हैं। एंड रेखा माँ हमारे साथ हैं। मैं चाहती हूँ कि एक बार रेखा माँ आए।
Yes, good evening, Richa. Good evening, Dr. Gaba.
Good evening. Good evening.
Good evening. Just listening to this young doctor, I'm thinking India has an amazing future. So, she's covered every aspect of our fears. And as a parent, I can visualize the parents, because skin is one of the organs that gives you the maximum trouble and the maximum concern. So, Dr. Deepshika, I know you're looking for me.
Yes,
I don't know where I am.
Yes, ma'am.
It should say Rekha Ma.
Let me pin both of you. Yeah, just a second, ma'am.
Yeah. Because I like her, she's doing this hide and seek thing. So
Actually, something went wrong with my thing, ma'am. So just
I will come in person and
Oh.
meet you. You are such an amazing
Yeah.
woman.
thank you so much,
need,
ma'am.
you need to be applauded because every concern that we have on skin, you have covered it so beautifully.
Thank
You've
you
given
so
us both the medical terms as well as the terms that a parent can, actually experience by understanding that all of this is curable. But when I get a call sometimes and they say, Ma, there's this concern, that especially skin, it takes much longer. I know you know that, and I know that. But the patience wears out because once it goes, it comes back again. And like you just mentioned, it just disappears very briefly, and again it's back again. So I know how concerned parents are about skin. And yes, I also have to tell you that we have very few dermatologists who are ready to understand the subject and understand all our children. So if you can identify people in every state, we will be really excited about that, because connecting the people to an immediate concern is what we like to do. Because you can't wait when you are seeing any of these issues with the skin. You don't feel like waiting because you're worried about your child. And also, doctor, you mentioned moisturizers. Now, I have a funny feeling that some of the doctors do go into a pharmacy and find something that they would like to market, which again is a concern for us. It might not agree with our children. So if you can just list a few moisturizers that will help our children, we would be really happy for that.
Yes,
And
ma'am, I'll just do that.
thank you so much. You're one amazing little kid. I mean,
Yeah.
you really, I can see you going places. And Dr. Richa and Dr. Gaba, thank you for connecting us. And as usual, you are always supporting our cause. Thank you so much, both of you.
Thank you,
Yes,
Sarika.
yes, Parul, if I start talking, I don't stop. You know that. That's why I keep away. But yes, you can ask the questions that are there. And I know parents have a zillion questions. Yeah, thank you so much, all of you.
Yeah, thank you, Rekha Ma. And yes, parents, we are afraid that you have to raise your hand and ask the question in person. So we have one hand raised, and if you can also switch on your video while asking question, I think it will be a delight for a doctor to answer. Yeah. So here is first question by
Prema.
Prema. Prema,
Yes, ma'am.
you can go ahead and ask Dr. Deepshika question.
My son Hemant, he is 21 years old. Hello.
Yeah, we can hear you. Dr. Deepshika,
मैम मेरा
Yes.
हाँ जी, मेरा बेटा है 21 इयर्स का। उनके इधर आर्मपिट्स में एंड ग्रोइंग्स में इतने बड़े-बड़े पिंपल्स टाइप के हो जाते हैं। काफी उनका ट्रीटमेंट किया, उसके बाद फिर वो अगेन एंड अगेन और हो जाते हैं। आर्मपिट्स में तो उनका ऑपरेशन भी हुआ है, बोथ आर्मपिट्स में, बट उसके बाद 1 साल के लिए स्टॉप हुआ था, बट अगेन फिर से स्टार्ट होने लग गया।
हाँ जी, मैंने बताया ये हिड्राइडिनाइटिस का प्रॉब्लम है, जो मैंने आपको बताया कि बम्स होते हैं अंडर आर्म्स में और फोल्ड्स में, और ये पेनफुल होते हैं, और
हाँ जी।
तो रप्चर भी हो जाते हैं। इसमें डॉक्टर आपको लंबे समय कुछ एंटीबायोटिक्स देंगे, जो कोर्स हमको प्रॉपर तरीके से करना है। और जब एक दाना भी हो तो उसको मैंने जैसे बताया कि बीटाडीन से प्रॉपर क्लीन करके दवाई लगानी है। दूसरी चीज जो भी डॉक्टर ने लिखी है वो दवाई लगानी है। तीसरा, वहां पे बाल ना रहे तो बालों को आप कट कर सकते हैं, क्योंकि बाल लंबे रहेंगे तो हाइजीन मेंटेन करना थोड़ा सा मुश्किल हो जाता है। और जैसा कि आपने बताया कि ऑपरेशन भी हुआ है, मतलब कोई बड़ा फोड़ा जो था वो बहुत बड़ा हो गया और उसको चीरा लगा के निकालना पड़ा।
वो मैम एक नहीं, एक के बाद कई होते गए।
हाँ, तो इसीलिए आजकल बहुत सारी दवाइयां दी जाती हैं जो लंबे समय बच्चे को देने से या किसी को भी पेशेंट को देने से ये बीमारी काफी हद तक कंट्रोल हो जाती है। तो और एक पॉइंट ऑफ टाइम पे कुछ पेशेंट्स में ये सेल्फ लिमिटिंग भी होती है, मतलब एक टाइम पे खत्म भी हो जाती है खुद से। पर जब तक हो रही है तब तक हमने ये करना है। दूसरा, अगर वजन ज्यादा है तो वो कम करना है, क्योंकि अगर वजन ज्यादा रहेगा, फिजिकल एक्टिविटी कम रहेगी, तो ये प्रॉब्लम बढ़ जाती है। तो पसीने से बचना है, हाइजीन मेंटेन करना है, वजन कम रखना है, ये जो हम कर सकते हैं। दूसरा, जो डॉक्टर से दवाई मिल रही है उसको बहुत रेगुलरली लगाना और खाना जरूरी है, तो हम वो ऑपरेशन की स्टेज पे नहीं जाएंगे।
बट मैम डॉक्टर भी गारंटी नहीं देते हैं कि ये सही हो जाएगा। वो बोलते हैं देख लेते हैं 1-1.5 साल तक दवाएं देके, क्या पता ठीक हो जाए।
नहीं,
तो
गारंटी तो हम किसी चीज की नहीं ले सकते क्योंकि हम बॉडी के बारे में नहीं जानते, बट जो भी जनरल जितने पेशेंट्स हमने देखे हैं तो ज्यादातर ऐसा ही पाया है कि सर्जिकल इंटरवेंशन ज्यादातर पेशेंट को नहीं चाहिए होता। अगर हम पहले ही उसको, तभी मैंने बताया कि शुरू में ही अगर हम इसको पकड़ लें कि ये लग रहा है और मेडिकल अटेंशन सीख कर ले तो ये इतना नहीं बढ़ता, क्योंकि अगर बढ़ने लगता है तो हम खाने की दवाइयों पे आ जाते हैं। तो वो एंटीबायोटिक्स होती है, वो कुछ समय चलती हैं, जैसे मानिए 3 महीने 4 महीने, जो सेफ भी होती है, प्रॉपर मॉनिटरिंग में दी जाती है। तो वो पीडियाट्रिशियन या डर्मेटोलॉजिस्ट जो भी जैसे आपको एडवाइस करते हैं वैसे लेना है। और इसके अलावा भी अगर बच्चा बड़ा है तो और भी दवाइयां आती हैं जो दी जाती हैं, और काफी हद तक काफी पेशेंट्स में ये कंट्रोल हो जाती है। बहुत कम पेशेंट्स होते हैं जिनको ये बार बार सर्जिकल इंटरवेंशन करके जाना पड़ता है, और किसी को बहुत ज्यादा है तो फिर एक तरह की सर्जरी होती है जिसमें अंदर के, और दूसरा जो सबसे जरूरी जो शायद मैं बताना भी भूल गई, वो ये कि कभी कभी जो लेजर से हम हेयर खत्म करते हैं इन एरियाज का, वो भी इस बीमारी को काफी हद तक कम कर देता है। तो आप अपने डॉक्टर से दोबारा सलाह कीजिए, वो आपको सही गाइड करेंगे, और ऐसा नहीं है कि ये खत्म नहीं होती या रुकती नहीं है।
Yeah, management is
बल्कि डॉक्टर
important. Yeah, we would like to move to the next question. Thank you so much.
ओके मैम, थैंक यू
Dr. Bhavna,
इसमें एक चीज ऐड करना चाहूंगा, मैं।
Yes, sir. Yes, sir.
हाँ, इसमें if you can give scrub bath, antiseptic scrub bath daily, that will reduce the colonization of bacteria. तो उससे भी काफी हद तक कम हो जाते हैं। दीपशिका जी, आप बताओ।
सर, एंटीसेप्टिक बात हेल्प करती है।
हाँ, बीटाडीन स्क्रब करें तो मैंने देखा है काफी हद तक कम हो जाता है फ्रीक्वेंसी।
Okay, thank you.
So I hope Prema has noted it. Thank you, Dr. Gaba, for adding.
Thank you, ma'am. Thank you so much.
Sami, I'd like to add a very important point here. I think most of our parents, from what I have understood, is a concern of hygiene. Let me tell you that in India, because we sweat much more, the underarms, the under armpits and between the groin area sweats the maximum. And the hair follicles are the concern for us, because even if you pull one of the hair follicles, you will see a boil. So I think what Dr. Deepshika was saying was amazing, that we should know how to keep our children absolutely clean. Get a nurse who will come and do the cleaning of the underarms and the groin area, because sometimes parents are a little reluctant to intervene about areas like this. So they feel very sensitive about cleaning them. You can't ask a 30-year-old to, you should basically have taught them all this, but also have it checked periodically, which is very important for us, because many people forget that hygiene in India, we are not changing underwears frequently. We are not using, these powders for underarms. I think it's so important that you check on your children periodically and make sure that, like she said, hygiene is the major aspect.
I fully agree with you, Dr.
Yeah, thank you, Rekha Ma, for bringing out that very important point. And yes, parents, we need to really maintain the hygiene management, and medical management is very important. Yes, Bhavna ma'am, you are there. If you would like to ask your question, please.
Yeah. Just, am I audible?
Yes, ma'am, we can hear you.
Good evening, everyone. Dr. Deepshika, I have a question for you. Dr. Deepshika, are you there?
Yeah, she's there. She can hear you, ma'am.
Okay. My son is 25 years old and he is showing vitiligo patches on the face, around the lip, and the hands, the dorsum of the hands. So I have shown it to the dermatologist. He has given a steroid course also in the beginning, and some local applications also. We use that. It really hasn't helped, which we didn't expect also, but it is also increasing steadily. So I wanted to know, is there any cosmetic treatment available for leukoderma these days?
Yes, in fact, for such vitiligo, which is acrofacial, means on the face and on the arms and feet. It has a bit of poor prognosis. It might not very well respond, but believe me, it is just a cosmetic problem. I know it is difficult to say that, do not be worried about it, because there
No,
is a
not
lot of
worried, but
social.
yes,
Yes.
it gives
So
actually a
yes.
bad feeling to
Yes.
others when they look
Yes.
at it and they say, "Oh, what has happened?"
So
I wanted
we
to know why
nowadays,
he's going out. So
we
is there a
nowadays,
cosmetic treatment? Yeah.
yes, we nowadays have micropigmentation kind of a treatment which is done by a lot of doctors. And here the shade of the skin is matched. Once the disease is stable, it is not increasing in size, then you can go in for such procedures where the color, just like tattooing is
Yeah,
done.
I understand
So
that.
color to similar to your skin is matched, and it can be done, and it would just gives a cosmetic relief. As far as if the disease is at increasing stage right now, consider for light therapy, which is there at a lot of bigger centers, which you can just visit, and you can start. It is safe, and it also the child will not be exposed, the person will not be exposed to oral medications also, and it will help in slowing down the thing, and maybe it will make it stable as well, and thereafter you can go in for such things.
Around the lips, a very sensitive area around the lips, is it okay for light therapy?
Yes, perfectly fine.
Achha, the other thing which I wanted to know is the temporary relief, like when we go out, like something like foundation or something. Is
Yes,
there any
no problem.
dermatological cream available?
Dermatologically, we do not have such foundations, but we do. Our lot of foundations, the cosmetic industries are very, very good. You can try the foundations as per the skin type, and they are good. No problems with it. So you can, girls are applying foundations daily. So why
Yeah.
not we can also apply foundations? Why can't we? So apply that foundation and you can step up. No problem.
Yeah. So can we move on to next question? Thank you, Dr. Bhavna. Shreya Chaturvedi, you can unmute yourself and ask.
मैम गुड इवनिंग एक्चुअली मैम मेरी डॉटर 7 ईयर की है और उसके हेयर अभी तक तो बहुत अच्छे थे, आगे बहुत ज्यादा हेयर फॉल हो रहा है उसको और वाइट होने लगे हैं.
Dr. Deepshika, can you hear the question?
Yes, ma'am. White hairs can be genetic. So हमें फैमिली में एक बार हिस्ट्री देखना पड़ेगा कि घर में किसी को जल्दी ग्रेइंग तो नहीं है. दूसरा
नहीं मैम, घर में किसी को भी नहीं है.
दूसरा डाइट का थोड़ा सा ध्यान रखना पड़ेगा. बाल झड़ रहे हैं मतलब कुछ एक्यूट हुआ था 3-4 महीने पहले, क्योंकि आज जो बाल झड़ रहा है वो 2-3 महीने पहले मर गया है, तभी वो आज झड़ रहा है. उसको समय लगता है झड़ने में. तो अगर बच्चा बीमार था, टाइफाइड डेंगू या कुछ भी ऐसा हुआ था, तो बाल झड़ेगा. दूसरा, डाइट में थोड़ा सा प्रोटीन का मात्रा बढ़ाना होगा. प्रोटीन रिच फूड उसको दीजिए, तो डाइट उससे भी अच्छा होता है. आपके पीडियाट्रिशियन जिनको दिखाते हैं, तो वो एक बार आपके हीमोग्लोबिन बच्चे का, थायराइड स्टेटस और ये सब इवेलुएट कर लेंगे, तो विटामिन डी कैसा है. तो इससे भी अगर इनकी कमी भी रहती है तो भी बाल जल्दी ग्रे होने लगते हैं. तो ये सब चीजें हमको देखती रहेंगी.
मैम थायराइड, विटामिन डी और आयरन तो हम इसका हाफ ईयरली चेक करवाते हैं और वो इसका सही है.
तो आप प्रोटीन की मात्रा बढ़ाइए, और फिर भी अगर होता है तो फिर हम दवाइयां कुछ देते हैं जिससे कि ये जो ग्रेइंग है वो बढ़नी रुक जाती है. बट कभी कभी अगर ये जेनेटिक है, घर में किसी को हिस्ट्री है, तो थोड़ा रोकना वो हो जाता है मुश्किल, अदरवाइज रुक जाती है. कुछ ऐसे प्रॉब्लमेटिक नहीं है.
मैम हम लोग साकेत में हैं, तो यहाँ आसपास आप या और कोई डॉक्टर हैं जिनको हम दिखा सकते हैं?
आप किसी भी डर्मेटोलॉजिस्ट को कंसल्ट कर सकते हैं. सब ये ट्रीट करते हैं. ये कॉमन प्रॉब्लम है, इसके लिए कोई बहुत ज्यादा एक्सपर्टीज नहीं ही है, और सब भी आपके वहां तो बहुत सारे होंगे. आप किसी से भी कंसल्ट कर लीजिए, दे विल गाइड यू.
Okay, ma'am. Thank you.
Thank you, Shreya.
Sammy, how old is the child?
Shreya, you have to mention how old is your child. You have to unmute. You have to unmute yourself, please.
11 year, ma'am. 11 year. 11 year.
11 years is a very, very tough stage. So I want to know whether there is any stress-related issues in the house. See, skin and stress go very closely. So please understand that 11-year-old having hair of that kind or losing hair is like what Deepshika said, could be an illness, or it can also be that the child is going through the change in the hormones. So that is also a very important point in persons with Down syndrome. For us, as trisomy 21s, everything revolves around your hormones. So please understand that the metabolism, the hormonal changes are all related with hair, skin. So you can't, separate the two. And I think Deepshika is being very good about saying that you will get a dermatologist very close to you. It is sometimes impossible to get a dermatologist who understands and cares. So we will also keep Deepshika on our roll. And if anybody is close by, they should visit her, because you know the subject and you will understand, and you can be, very calm with our parents, because the parents need someone who is a calming effect, rather than telling them that this is a stress situation and taking them in for a surgery. You know that we don't allow surgery, most often don't allow surgeries. And like you said, it is not necessary. We should be controlling it with antibiotics and care. So let's put that up on our thing, that if Deepshika is close by, they should refer her or take an appointment and travel.
Yeah, Shreya, I think you will be able to travel within the Delhi. So thank you for the question. We will like to ask Vandana to unmute and ask question, please.
थैंक यू मैम. गुड इवनिंग डॉक्टर. मेरी बेटी 15 इयर्स की है. उसको जो आपने हेड पैचेस का बताया था, वो उसको कभी कभी साल में 6 महीने में हो जाते हैं. तो एक माइनोकेम एन करके सोल्यूशन डर्मेटोलॉजिस्ट ने शुरू में दिया था, उससे वो ठीक तो हो जाता है, थोड़े दिनों में बाल तो आ जाते हैं. पर अब जैसे वो बड़ी हो रही है तो कई बार ऑकवर्ड लगता है कि इतने बड़े बच्चे के बाल कई जगह से कई बार. तो उसके लिए कोई परमानेंट सोल्यूशन है? वैसे उसके बालों का टेक्सचर उसके बाद अच्छा हुआ है, पहले थिन थे.
नहीं, ये एक ऑटो इम्यून कंडीशन है. इसमें हमारा इम्यून सिस्टम जो है वो बालों की जड़ों को बार बार खा जाता है, वो कंफ्यूज हो जाता है और वो खा लेता है. तो हम ऐसा कुछ तो नहीं कर सकते कि हम अंदर घुस के कुछ इम्यून सिस्टम को चेंज कर पाए. बट जैसा कि मैंने बोला, स्ट्रेस इसको हमेशा एग्रवेट करता है. अगर छोटे ही पैचेस हैं, आपको पता है बाल आ जाएंगे, तो ना तो स्ट्रेस लीजिए ना बच्चे को दीजिए. बट ये है कि जैसे जैसे ये बड़ा होगा, बच्चा बड़ा होगा, थोड़ा लाइफस्टाइल, हर प्रॉब्लम में लाइफस्टाइल बहुत इंपॉर्टेंट है. ओबेसिटी नहीं होना चाहिए, हेल्दी आप एक्सरसाइज टाइम हो डेली बच्चे का 30 मिनट्स, योगा जैसी चीजें अगर हम इनकलकेट कर सकते हैं, तो ये सारे डिसऑर्डर्स मिनिमाइज हो जाते हैं. और एक पर्टिकुलर टाइम पे हो सकता है इट विल जस्ट फिनिश ऑफ. तो नथिंग टू बी वरीड अबाउट अनलेस एंड अंटिल इट इज रैपिडली इंक्रीजिंग, कि वो पैचेस दिखने लगे. अगर वो दिखने लगे तो हमको ओरल ट्रीटमेंट अपने डर्मेटोलॉजिस्ट से सीख करना है, नहीं तो आप जो जैसे है ऐसे ठीक है, वुड बी फाइन.
थैंक यू सो मच.
Yeah. Komal, we would request if you can switch on your video, we'll be able to pin you for the question. Shubhangini, yeah, Komal. Yeah. Komal, unmute yourself and ask your question, please.
Yeah, good evening, madam. I'm Komal Jain, mother of Misty Bandari, who is 7 months old. And from her birth, I find that she's having a dandruff and dry scalp. So can we use Himalaya shampoo? Is that safe for baby Himalaya products for skin and hair?
I cannot recommend you cosmetic brands right here, because I personally do not have a good experience with the cosmetic brands, because we do not suggest them. And dryness अगर scalp में है, तो we do not know that it is general, that atopic वाला dryness है कि वो dandruff वाला dryness है. So I would just use that, say that जो भी आप खरीद रहे हैं उसके अंदर SLS वगैरह जैसा component, harsh component ना हो. शैम्पूइंग आप रेगुलर क्लिनजिंग कीजिए, बट बहुत ज्यादा शैम्पू एप्लीकेशन करने की जरूरत नहीं है. और अगर उसके बाद भी ठीक नहीं होता है तो एक बार दिखाना ठीक रहेगा, ये जानने के लिए कि हम क्या ट्रीट करें. डैंड्रफ ट्रीट करना है कि ड्राइनेस ट्रीट करना है, वो पता होना चाहिए पहले. ज्यादा चेंज केमिकल्स वाली चीजें नहीं यूज कीजिए.
ओके, कोई भी बेबी प्रोडक्ट्स में SLS का नहीं होना चाहिए.
हाँ जी.
थैंक यू डॉक्टर.
Yeah, thank you, Komal. Shubhangini ji, you can unmute yourself and ask your question, please.
अभी 2-3 साल हो गया है और थोड़ा थोड़ा बाल झड़ते झड़ते सब बाल खत्म हो गया। हम डर्मेटोलॉजिस्ट के पास गया था, वो भी फिनोलेपिक क्या है वो किया है, लेकिन बाल अभी तक नहीं आया है। ऐसा आईब्रो में भी बाल उठ के आए। मेरा चिंता हो गई थी पहले पहले क्या करूं, लेकिन ये क्या प्रॉब्लम है, ये क्या हार्मोनल प्रॉब्लम है या क्या थायराइड का प्रॉब्लम है, ये क्या है मैम, हम समझ में नहीं आता है। लेकिन मैं अभी भी ट्राई करती हूँ, क्या आएगा क्या बाल? पूरा झड़ गया है। रश्मिका डांसर है, बाल तो जरूरी है। ऐसे थोड़ा बाल लगा देते हैं हम। साइकोलॉजिकल पहले इफेक्ट हुआ था, क्योंकि मेरा साइकोलॉजी इफेक्ट होने से रश्मि भी हो जाएगा, इसलिए रश्मि को भी बोल दिया नहीं, बाल नहीं होने से कुछ प्रॉब्लम नहीं है। लेकिन मैम आज जो इतना अच्छा टॉपिक है, मैं जानना चाहती हूँ वो क्या आएगा क्या बाल? और
देखिए, ये जैसा आप बता रहे हैं, ये एलोपेशिया लग रहा है। एलोपेशिया एरिएटा जो बढ़ जाता है और टोटालिस या यूनिवर्सालिस मतलब बॉडी के बाल को भी इन्वॉल्व कर लेता है। तो इसमें कभी कभी ऐसा होता है, जो भी ओरल हम खाने की दवाइयां देते हैं जिससे इम्यून सिस्टम जो है वो दब जाता है और ये बीमारी रुक जाती है। तो अगर आपके डॉक्टर ने ऐसा कुछ किया है और उन्होंने आपको जो भी दवाइयां दी है तो वो उसको टाइम पे कीजिए। अगर उसके बावजूद कभी कभी बहुत रेयर ऐसा होता है कि दवाई छोड़ने पर वापस बाल चले जाते हैं, मैं मानती हूँ ऐसा होता है, उस केसेस में हमको कॉस्मेटिक ट्रीटमेंट के लिए जाना पड़ता है। बालों में जैसे विग का इस्तेमाल करना और आईब्रोज में जैसे पेंसिल या टैटूइंग कराना, ये रहता है। ठीक है, तो
अभी थोड़ा थोड़ा आया है, अभी थोड़ा
अगर आया है तो दवाइयां आप, हाँ दवाइयां आप कंटिन्यू करिए।
ये आईब्रो अभी थोड़ा थोड़ा है, हम जो वेसलिन कुछ लगाते हैं और इसमें भी देखिए आप, ये हो गया है। कभी कभी बाहर जाता है तो बाल लगा लेती है, नो प्रॉब्लम। लेकिन हम सोचे एक्सपेक्ट कर रहे हैं क्या आएगा क्या नहीं।
हाँ, तो वही मैं कह रही हूँ, एक बार अपने आसपास किसी डर्मेटोलॉजिस्ट से दोबारा मिलिए। वो एक बार दवा खाने का शुरू करेंगे, खाने की दवा से कई बार मरीज का बाल आ जाता है। इन केस नहीं आया तो कॉस्मेटिक इलाज तो हमेशा है ही हमारे पास, क्योंकि प्रॉब्लम भी कॉस्मेटिक ही है ना।
हाँ हाँ जी, ठीक है, थैंक यू।
थैंक यू शुभागिनी जी। Aditi's mother, Millie, you can unmute yourself and ask the question.
जी मैम, गुड इवनिंग टू ऑल। डॉक्टर मैम, आदिति इज 14 इयर्स की है, तो उसका बार बार जो आप जैसे बोल रहे हैं ना, बबल्स जैसे निकल जाता है बॉडी में, मैक्सिमम टाइम उसके जो जांघे में निकलता है, तो बड़ा होके पूरा पेनफुल होता है, तो वो चल नहीं पा रही है। मतलब ये उसको बार बार हो रहा है, मतलब 1 ईयर में 3-4 बार ऐसे ही हो रहा है। तो उसी हिसाब से हम लोग डर्माटोलॉजिस्ट को दिखा के वो मेडिसिन दे रहे हैं, कंटिन्यू कर रहे हैं, फिर भी वो बार बार निकलता है, तो क्या करें? और वो डॉक्टर भी बता रहे हैं कि उसको मतलब नहाने के बाद सोप वगैरह यूज करने के लिए मना किए हैं। तो फिर क्या कैसे किया जाए, कुछ सजेशन दे सकेंगे क्या?
मैं एग्जैक्टली समझ नहीं पा रही, बबल्स आप किसको कहना चाह रहे हैं? या तो आप पानी वाले छाले को कहना चाह रहे हैं कि आप दानों जैसी?
जी मैम, दानों जैसे हो जाता है मैम।
दानों जैसा हो जाता है तो वो हिड्राइडिनाइटिस ही रहा है जो मैं आपको कह रही हूँ। तो जो भी आपके डॉक्टर सलाह दिए हैं वो कीजिए, जो दवा बताए हैं वो भी कीजिए। और जैसा मैंने बोला कि अगर वजन है ज्यादा है तो वजन को कम करना है, सफाई रखनी है, जैसा कि सर ने भी बताया था, बीटाडीन से आपको बात करना है, उसको साफ करना है एरिया को। लगाने की दवा, कई बार लगाने की दवा ही लंबे समय लगाने से वो सही रहता है, तो हाइजीन प्रैक्टिस करना है, दवाइयां लेनी है। मैंने बोला काफी हद तक ठीक हो जाता है। अभी एग्जैक्टली सिचुएशन कैसा है बिना देखे मेरे लिए बताना मुश्किल है, बट मैं इतना जरूर कह सकती हूँ कि जो भी आपको ट्रीटमेंट दिया है वो जरूर फॉलो कीजिएगा, इरेगुलर नहीं रखिएगा और जनरल केयर पे ध्यान दीजिएगा थोड़ा।
अच्छा मैम, बॉडी में शॉप वगैरह या शैम्पू वगैरह देने के लिए मना किए, तो कैसे, किस टाइप का शॉप और शैम्पू यूज करने से बेटर रहेगा इन लोगों के लिए?
मैं एग्जैक्टली नहीं जानती कि क्यों मना किया है, घाव बना है इसलिए मना किया है, तो अब मैं बोल नहीं सकती कि आप
बार बार यूज करने के लिए मना कर रहे हैं बॉडी में। तो ये तो मतलब शैम्पू और शॉप
देखिए
से तो
ऐसा भी हो सकता है कि वो कुछ और हो, वो एक्जिमा जैसी चीज हो जहाँ पे हम साबुन का इस्तेमाल बार बार मना करते हैं। और हिड्राइडेनाइटिस में भी हम साबुन नहीं, हम बस बोलते हैं एंटीसेप्टिक सोप से एक बार अच्छे से साफ करना है, दोनों टाइम बीटाडीन से साफ करना है, तो कोई भी अच्छा साबुन आप इस्तेमाल कर सकते हो। और अगर वो एक्जिमा जैसी कंडीशन है, क्योंकि मैंने देखा नहीं है पेशेंट को, तो अगर एक्जिमा जैसा है, हाँ, तो यहाँ पे हम जरूर बोलते हैं कि आप सोप भी अवॉइड कीजिए। सोप जिनके अंदर साबुन का कंटेंट नहीं, का सर्फेक्टेंट का कंटेंट नहीं है, वो इस्तेमाल कीजिए। तो एग्जैक्टली जैसा आपको उन्होंने बताया है आप वो करके देखिए, नहीं तो दोबारा राय लीजिए एक बार।
अच्छा, ठीक है, ठीक है।
Yeah,
Thank you.
Yeah,
Thank
thank you, Millie. Yes,
Thank you,
it
ma'am.
has been such an enlightening session and Q&A.
I would want to know the expert
ma'am.
comments of
Sorry.
Dr. R.P. Singh, sir.
Yeah.
Expert advice and expert comments of this from Dr. R.P. Singh, sir.
Sir, we are waiting to hear you.
The topic is very nicely covered by Dr. Deepshika.
Yes.
The topic is all these skin diseases are more common in the Down syndrome because they are not able to look after themselves properly, and most of the diseases are due to the non-maintaining the hygiene, as Dr. Eczema has said. Two things I like to add. One is the area like Hidradenitis area and other. As Dr. Gaba said, with you can apply betadine twice daily if the disease is active. And secondly is the more important is seborrheic dermatitis, which is the scalp as well as in groin or other areas that requires sometimes antifungal treatment where the medicine has to be left for 24 hours. Not only just applying shampoo. People think by cleaning various shampoos, you can control seborrheic dermatitis. So various shampoos are recommended. Shampoos are cleaning or which are having, say, they are just coming in short contact therapy, which are not able to clear or even kill 10% of the load of the fungus. So fungus is an organism which requires continuous drug to control it. That's why 24-hour application of the drug, be it the antifungal, when it is required, the treatment should be given when the disease is severe, or the mild treatment to be given when the disease is mild. But treatment has to be given when the seborrheic dermatitis. Third is the hygiene as well as the healthiness of the skin by giving a lot of proteins. The Indian people are usually deficient in protein. They take much less protein as it is required by the body, and the skin and the hair basically shedding the protein. The body protein, which is it is reutilized, while the protein from the skin is continuously shed. That's why the requirement of the protein. And if we are not taking proper protein, the skin will not be healthy. It will get repeated infections. It will be dry. And for the parents, I'll say keep hygiene, use minimum soap on the body so that dryness does not occur. Take at least while bathing, sit in the water for 5-10 minutes, apply any oil on the body, say coconut oil or even liquid paraffin, and then again take a bath. This will maintain the very simple technique to maintain moisture in the skin. Not to use costly moisturizers and other things. Very few, any amount of moisturizers will not help if you are not applying any oil in the wet skin. And I'll sum up: maintain the hygiene of the skin, maintain the moisture of the skin, and whenever a disease process appears, take the treatment of the dermatologist, nearby dermatologist, of course. And most of the dermatologists are well qualified to treat such conditions. That is, I'll sum up.
Yeah. Thank you so much, Colonel R.P. Singh, for those expert remarks in the end. And we are getting many messages as a host that can we consult Dr. Deepshika or Dr. R.P. Singh, online. So otherwise, the parents, you will get all the info. You type in their name on Google, and Google will tell you everything about them. But do you give online consultation also, Dr. Deepshika?
Both me and my father, both of us give online consultations.
Yeah.
But sometimes in some conditions, it is not possible to make an online judgment. So in that case, we ask the patient to visit in person to us or some other dermatologist. So there we deny that the online would not help. But wherever it can, we do.
Yeah. So parents, it's for your information, and the tips and tricks, all the doctors have said, you can revisit our YouTube channel and look at this session and, note down again if you have not noted down it right now. And yes, just Google their name and Google will tell you everything about them, where they are. So, and for Delhi parents, they are in Delhi, in, somewhere near Pitampura. So it's easy for you. Rekhama.
Yeah, the most important thing that I wanted to add to Dr. R.P. Singh is, yes, healthy lifestyle. So exercise, fitness, keep your children. If you don't do, they don't do. So it's all about the parent. I think what we inculcate into our children, especially on a dining table. If you are eating a cheeseburger, don't expect your child to have a roti and dal. So he's going to also want the same food. So try to make your eating, your exercise routine, and your cleanliness a habit. It's so simple, but then what happens? We complicate issues. Yes, there are some issues which are underlying in every child with Down syndrome, and like Deepshika said, I agree with her. Every case is an individual case. So we cannot generalize, especially when it comes to the skin. It's not like saying, okay, you have a stomach pain, so I can help you. This is a very, very complicated procedure which needs intense care and continuous monitoring. So I think all the parents, stop stressing about your children's skin. They will get okay, and you have Deepshika to help us. So we are on the road to recovery. I'm feeling very happy. I'm meeting her for my skin next time I'm in Delhi.
Yeah.
Yes, Rekha ma'am, मुझे साथ लेके जाइएगा.
Yeah, and Dr. Deepshika has just put on a list of common good moisturizers in chat box. Quickly, you can note down or take a screenshot of it. I have taken my screenshot. So it was so empowering and so enriching. And yes, it reminded us of so many good, important daily hygiene habits. We need to really be careful. And many times we blame the doctor, but listen, there a lot of onus is on us also to maintain the hygiene. Yes, Parul, I can see your hand raised. Please come and ask.
मेरा एक सवाल है समीक्षा, जो मैं डॉक्टर दीपशिका से पूछना चाहती हूँ. मेरी बेटी 15 साल की है, डॉक्टर दीपशिका, और उसको गर्दन में यहाँ पर कई बार ब्लैक हो जाता है यहाँ तक, और स्किन में लेयर्स ही बन जाती हैं स्किन की, और छोटे छोटे 2-3 दाने जैसे स्किन के इमोल से बन के भी उसको यहाँ पर आ गए हैं. तो इसके लिए क्या करना चाहिए?
ये जैसा आप बता रहे हैं, अगर ये रहता है, ये जाता नहीं है रगड़ने से, कई बार वो मेल जैसा इकट्ठा होता है, उसको डर्टी नेक बोलते हैं, क्योंकि हाइजीन हम ध्यान नहीं रख पाते. लेकिन अगर ये जाता नहीं है और वहां दाने दाने से भी है, स्किन बम्प्स है, तो अकैंथोसिस मालूम पड़ता है. तो आप एक बार, अगर वेट ज्यादा तो नहीं है तो उस हिसाब से.
हाँ जी, वेट उनका ज्यादा है, दाने वैसे नहीं है, कोई वैसे नहीं है, और ये कभी अपने आप ही कम ज्यादा होता रहता है.
वो इंसुलिन रेजिस्टेंस का ही साइन है. हमको वेट रिडक्शन करना रहेगा और उसके बाद एप्रोप्रिएट ट्रीटमेंट. अगर पहले ट्रीटमेंट खाली करेंगे तो फायदा नहीं है. वेट रिडक्शन सबसे जरूरी है इसमें.
ओके.
Also, Deepshika, I think you have to advise the parents about jewelry. See, artificial jewelry on the neck, near the ears, can always create an added incentive to creating infections and rashes around the neck. I feel a lot of this artificial jewelry sometimes can be an irritant. Absolutely. So I think we have to be careful what we subject our children to, or what with jewelry we put on them, and maintaining a clean atmosphere without putting too much of all this artificial stuff. So I think parents have to be careful.
We have already overshot time by more than 20 minutes. And we really appreciate Dr. Deepshikha and Dr. Colonel R.P. Singh and Dr. Richa and everybody from IP Dr. Devendra Gama to allow to come on this platform. And we are so excited. I'm short of words that, how to appreciate. And we are looking forward for this association for a long, very long time, I guess, till eternity, I would say. And I really want to say a deepest heartfelt thank you to everyone. And believe Dr. Deepshikha and Colonel R.P. Singh, your clinic is going to get bombarded by our, parents' queries. And yes, they will definitely take care now. We can assure that they'll take care of hygiene. Yes. Anything else you want to add, Parul or Richa ma'am?
It was a wonderful presentation, Deepshikha ji, and with expert comments of Dr. R.P. Singh, Dr. Surekha ji, and very well moderated by Samiksha and Parul ji. And I think we were, as a parent also, I learned many things. And as a pediatrician also, whatever has been discussed today is going to add on to my knowledge, and which I'm going to impart in my day-to-day practice. And I thank all the parents for a very interactive session. It was a very fruitful discussion for all of us. And I want to thank my president, Dr. Gaba sir, for always being there as a support and all my ventures, and who stands by me. And all the members of IAP who have logged in today, even from the other fraternities, from the medical fraternity, all those who have joined from the international, from South, I thank you, each one of you. Deepti ji and Brinda, I really want to thank you. Thanks from the core of my heart. Thank you.
बहुत बहुत शुक्रिया डॉक्टर रिचा। हम आईएपी के हमेशा शुक्रगुजार रहेंगे कि इस तरीके से हमारे एक छोटे से इसरार पे आप लोग चले आते हैं और इतना समय हमारा देते हैं। और डॉक्टर देवेंद्र को तो अब हम कहते हैं कि हमारे अपने हैं। तो डीएसएफआई की तरफ से
always.
जी डॉक्टर गाबा।
So with this, I think we would like to end the session today.
Thank you.
Yeah, thank you so much everyone for joining. Looking forward for more such sessions, and see you in next Saturday session. Bye bye. Good
Thank
evening.
you, everyone.
Thank you, Dr.
Thank you.